As life expectancies lengthen and the world population of people aged over 65 is booming, older people continue to face ageism, treated as invisible, stereotyped and discriminated against. And this impacts on their health and quality of life and ignores their social and economic contribution. And the situation has been worsened through the COVID-19 pandemic. On the International Day of Older Persons, doctors say that combating ageism will result in healthier, more active aging and enable society to benefit from the economic participation and social value of the growing population of over 65s. Expected to be more than double by 2050, and statistics show that over 65s already outnumber children under the age of 5. Projections are that by 2050, there'll be twice as many people over 65 as children under the age of 5. And they'll also outnumber 15 to 24-year-olds. Half of all children born in 2020 are now predicted to live beyond 100, meaning that older people will no longer be invisible or irrelevant. Well, for a better understanding of how ageism affects older people and how it impacts their mental well-being and what society should be doing, we're now joined via Zoom by Dr. Sihle Nhlabathi, who's a member of the South African Society of Psychiatry. Thanks so much indeed for joining us and welcome to the program.
Hi, Peter. Thank you for having me. Good evening to the viewers.
All right, so I'm starting to get grey hair and I'm worried that I might be categorized soon in this group. I'm just wondering, what is ageism?
Okay, so it's interesting you should say that you are almost going grey, because age is one of the first things that we as humans tend to notice about people. So ageism arises when age is used to categorize and divide people in ways that lead to harm, ways that lead to disadvantage and injustice, and therefore leading to an erosion in solidarity across generations. And so when we talk about... Continue, please.
All right, so what you're saying, and I'm just wondering, is this as a result of stereotypes, myths that we believe about older people?
Yes, so ageism in itself refers to stereotypes, stereotypes being how we think, refers to prejudices, how we feel about people or certain situations. So it also refers to discrimination, so how we act informed by how we think and feel. And usually these are the attitudes that are directed towards people on the basis of their age.
Is this something that might be happening subconsciously, that we automatically think that an older person can't hear, that we think that an older person is now becoming like a child? I mean, we watch movies. How are these stereotypes built?
Okay, so your question speaks to how does ageism start? Ageism starts in childhood. It is reinforced throughout life. Children tend to pick up social cues from those that are around them. Those that are around them inform them about cultures, and they soon develop prejudices, and soon these prejudices are internalized and they inform their perspective of the world.
All right, so on a day like today, International Day of the Older Person, what should we be thinking about more consciously?
Okay, so it's important to think about strategies that we can use in order to try and address the problem of ageism. So there are some strategies that have been identified. These strategies are evidence-based, so there's a lot of evidence for them. there are policies and laws that need to be implemented in each country, and this also addresses the international community. These laws, when they are put in place by our lawmakers, should be monitored and evaluated, and there should be mechanisms to enforce these laws that will give consequence to those that perpetuate ageism practices. Then there's also interventions like educational strategies, whereby education can be provided to the population, starting from as early as primary school, going on towards high school, university, even in non-formal educational facilities, where these attitudes would be challenged over and over again. The other strategy that could be used is encouraging ongoing intergenerational contact in order to foster interactions between people of different generations.
What do you see in practice in terms of how older people feel and start to feel when this ageism happens and they start to feel invisible and unnoticed?
Okay, so these attitudes that we live amongst, frequently they are then internalized by people that are elderly. So people would perceive elder people as frail, perceive them to be incompetent or incapable of learning new skills. They would experience exclusion from the job market. They would experience exclusion in terms of health services. Some treatment interventions would not be offered to them by virtue of their age. Some start to feel unattractive. Often the elderly are regarded as asexual, and they also lose motivation in terms of keeping up their physical health. So if you are seen as somebody that doesn't contribute to society, you start to feel like an outsider, and therefore you develop mental health diseases like depression and anxiety.
Yeah, it's quite a thing that you're saying. I knew a woman once who I spoke to, and she was a model when she was much younger. And she said, one of the things that she finds difficult about aging is that people notice her less and less. And that must start to play on your identity, your self-worth, and your self-value.
Yes, it does. And the unfortunate thing is, where you would seek help is to talk to your psychiatrist or your social worker. But it even happens that in health institutions, you find that the same attitudes are still there. So even in terms of accessing mental health, for example, as an elder person, it's more difficult compared to somebody that is younger. There's also the assumption that cognitively you cannot engage because you are elderly, or you are just dependent on the state, for a lot. Like, for example, when you talk about social grants, frequently the elderly are seen as a burden in all aspects of society. And this is the myth that we are trying to dispel.
So what does the science tell us about our mental acuity as we get older, our ability to work as we get older? What does the science say?
Okay, so it is important to admit or to realize that aging is associated with development of some cognitive impairments, but the elderly people are not a homogeneous population. Development of cognitive impairment and functional decline is dependent on a case-to-case basis, and how early it presents depends on lifestyle choices, for example, and how many comorbidities or diseases you have on board. elder people still have a lot of value to bring to society. They are the keepers of cultural knowledge. They tend to make more informed, cautious decisions compared to the youth. They take care of our children when we leave them with them to bring them to major centers. Even in terms of in an employment scenario, the elderly can provide more organizational memory and therefore more best strategies for an organization. So there is value that they still bring. It's not all elderly people that suffer from cognitive impairment or functional decline.
Yeah, I mean, I can only imagine the experience that you build up over time and knowledge and wisdom. You turn 65 and they switch it off completely. And I just don't understand. What is it about 65?
You're encouraged to retire.
Exactly.
Yes.
What is 65 just a arbitrary figure? There's no science behind that number?
Well, it's important to classify phenomenon, to classify age groups. It helps us organize and implement strategies to deal with different population groups. But it is by no way a scientific way of viewing human beings. Human beings are diverse and they have diverse abilities. As much as the World Health Organization classifies the elderly as 60 or 65 years and above, it still does not inform what your abilities are, what your functional levels are, what quality of life you have, and what you bring to the table in any given circumstance. So I would say that it is an arbitrary number.
And do you still have good ability? I mean, they talk about older students to pick up books and start studying again.
Yes, so the more you study, the more cognitive reserve you develop. So it's like going to the gym and exercising your muscles. How you perform cognitively is informed by what you have done before. So if you have been a student over a period of time, you have been having healthy habits, you've been eating well, exercising, then there shouldn't be a high risk of developing cognitive impairment, and you can learn. Learning is lifelong.
You talk about something called active aging. What is that?
Active aging is a policy that informs trying to give good quality of life to those that are elderly, to still assist them to retain their autonomy and to assist them to feel that they still do have value to offer to society. So active aging involves keeping fit, active physically, keeping mentally stimulated, encouraging social participation in those that are elderly, and making sure that you give all resources that are available to even younger population groups, also to the elderly.
Dr. Sihle Nhlabathi, thank you so much indeed for joining us. I know that I'm much closer to this age group than you are, so I'm grateful for this conversation. Thanks so much indeed for joining us.